The pitch is presented by Knowledge Success and supported by USAID and the Bill and Melinda Gates Foundation.
The competition that's transforming how we think of knowledge management and family planning is back. This is the pitch, a continental competition looking for the next knowledge management and innovation in family planning and reproductive health. From over 80 applications from around the world, 5 were chosen as semi-finalists from Africa. With just 3 minutes to deliver their pitches, they will be under pressure to convince our judges to fund their innovations. Last season, we saw amazing innovations that use creative tools and techniques to interpret family planning data and make family planning information accessible through data visualization. Ultimately, 2 pitchers were awarded a total of $100,000 to fund their ideas. White Ribbon Alliance for Safe Motherhood in Malawi created a family planning dashboard on the District Health Information System, DHIS2, that links to Malawi Ministry of Health website, strengthening data for decision making. Stand With a Girl initiative in Nigeria strengthened the capacity of youth data advocates to interpret data on adolescent use of contraception through storybooks in order to advocate for adolescent responsive family planning and reproductive health programs amongst policymakers. This season, we've invited organizations to submit innovations that address knowledge management challenges in their region or country, such as youth or COVID-19. A total of 4 winners, 2 from Africa and 2 from Asia, will be selected as our Knowledge Management Champion Innovators. A 5th award will go to a winning pitch of the judge's choice. The 5th innovation can come from either region. Will it be awarded in this episode? Keep watching to find out. Determining who will win an award of up to $50,000, let's meet our 5 expert judges. Gertrude Odezugo is a Senior Reproductive Health Manager at USAID in Nigeria. Eric Bernardo is the President of the Philippine Society of SRH Nurses and Philippines FP 2030 Youth Focal Point. Emily Mangoni is a Program Officer for Optimized Family Planning Program at the Bill and Melinda Gates Foundation. Dr. Tara Sullivan is the Project Director of Knowledge Success at the Johns Hopkins Center for Communication Programs. Daudu Idrisu is the Country Liaison Associate
For Benin, Togo, and Mauritania with the Ouagadougou Partnership.
The stakes are high. Who has what it takes to be one of the next Knowledge Management Champion Innovators? Hello, I'm your host, Irina Lenga from Knowledge Success. We are so excited to see what's in store for an all-new season of The Pitch. Before we meet our semi-finalists, let's hear from the judges about what they're looking forward to in this competition.
Okay, merci beaucoup. Pour moi, la plus grande opportunité qu'offre ce concours, c'est le fait de donner la chance à tout le monde de pouvoir s'exprimer, de pouvoir innover sur les approches de partage, de gestion de la connaissance à tous les niveaux. Donc, la plus-value, c'est vraiment l'équité, en fait, en termes de contribution, de création de l'information que cet espace offre à tout le monde, quel que soit son niveau, quelle que soit son appartenance linguistique, quelle que soit la région à laquelle elle appartient. Voilà une très belle expérience et que nous sommes ravis de pouvoir contribuer à sa réalisation. Merci beaucoup.
I'm very excited to be part of this process that adds to all that's already being done in countries, especially the FP 2030 commitment making countries, as solutions to meeting set FP 2030 goals, or more broadly, country family planning goals, especially in Africa, where I come from. You know, many of the countries reached with this speech are countries that still struggle with addressing some access objectives, access to family planning, and even especially regards equity and sustainability. So I'm really, really glad that we have this pitch. Like I said, it's going to add to what we're already doing. And I see that inch by inch, we'll be able to reach our set objectives come FP 2030 or come 2030 or even before 2030.
Thank you, judges. Now, let's get started with our first semi-finalist.
Four is the number that keeps me up at night. According to the Guttmacher Institute, Nigeria loses about 96 women and girls daily to unsafe abortion. As a data kind of guy, I divided 96 by 24 and I got 4, which means for every 1 hour, 4 Nigerian women and girls will die trying to remedy an unplanned pregnancy. My name is Offor and I lead the Geographical Information System at Ritigreat Foundation. Ritigreat is a feminist non-profit that leverages big data and new technology in increasing access to SRHR services and information for Nigeria's adolescent girls and young women. There is more data available today than ever before, thanks to the rapid advances in technology. Yet too often, business leaders, policymakers, and analysts do not have access to the data with which they can make informed decisions about increasing FP access in the last mile. There is no established means or tool that aggregates, analyzes, and visualizes location-specific, sex and age disaggregated SRHR-related data. Our proposed innovation, the Niger FP Atlas, is an online open-source interactive platform powered by machine learning that we visualize hyperlocal data from existing survey, global satellite images, and point of interest data in building hyperlocal family planning hotspot maps that will indicate where family planning is most limited. It will also visualize population characteristics data for any chosen location on the map, even down to the 1 square kilometer. Remember, understanding population characteristics is key in increasing family planning demand in the last mile. These two will enable much more comprehensive and geographically targeted contraceptive planning for government health institutions, SRH organizations, international development financing institutions, and donors. The Niger FP Atlas was conceptualized using a human-centered design approach, and the 50,000 USD prize from this competition will help us move our innovation from the prototype phase to the pilot phase. 60% of this funding will be spent on our machine learning models, 20% on web hosting and email marketing, and 20% will be spent on staff time. The impact of this innovation in the family planning community in Nigeria will be enormous, as family planning professionals can better understand where to most effectively channel resources and funding in improving access to ensure no one is left behind. The option before us today is to welcome machine learning and its infinite potentials in the knowledge management space in the family planning field in Nigeria, and also work and leverage on the limitless possibilities of human-centered design to make access to hyperlocal FP data and population characteristics data accessible and equitable for all family planning professionals in Nigeria. Thank you very much.
Excellent job. Let's hear some questions from our judges.
Ma question est de savoir, est-ce qu'en dehors des données démographiques, l'Atlas prendra en compte également les données liées aux formations sanitaires afin de pouvoir évaluer l'accessibilité en termes de temps et en fonction également des distances pour voir en termes de cartographie?
Thank you very much. As I said, data will be visualized up to the 1 square kilometer level. So in the 1 square kilometer you select on the map, it's going to visualize if there is a tertiary health center, there is a primary health center or a secondary health center. Is it state government owned? Is it private owned, or is it federal government owned health centers at that particular location selected on the map? And we are thinking even beyond accessibility of these X centers for populations at this particular location. We're also thinking of population characteristics like what is their spending characteristic at that particular point in the map, what is the access to radios and televisions, especially for social and behavioral change communications program with professionals that might be leveraging on our tools. So they might know in a particular square kilometer, these are the numbers of women living there, age disaggregated, sex disaggregated, and also their access to telephones, their access to the internet, their access to radios and televisions, and also what is the spending characteristic there? Are there cash customers there? Are there credit customers there? So we are visualizing beyond even accessibility of hospitals and health centers at even the 1 square kilometers, and we're even looking broadly at the population characteristics. So in answer to your question, yes, health centers accessibility, their distance and their location exactly on the map will be depicted on the Niger FP Atlas.
Hi, this is Eric Bernardo from the Philippine Society of SRH Nurses and the Philippines FP 2030 Focal Point. Good job for that excellent presentation. And my question is, who do we target? What is your target? Who is your target audience for this innovation? Is it for healthcare workers so that they would know which areas need more access to services, or do we target policymakers and that? Can you talk a little bit more about that? Thank you.
As I said, we took a human-centered design approach to ideating this innovation. So this innovation is going to serve a large array of family planning professionals, from government health institutions who want to sit in Abuja and understand what is happening in the last mile, SBCC professionals. My background is in SBCC. SBCC professionals can also leverage on this innovation to plan. International development finance institution, like you said, can be able to, when planning and mapping and budgeting, can leverage on this tool to understand what's happening in the last mile. How do these people access family planning? How do we get family planning messages across to these people in the last mile? Youth leaders like myself can also be able to look on this map. I know we have a large population of adolescent girls and young women on this particular hotspot on the map, so we can be able to craft family planning messages or family planning campaign in this particular location. So is equitable, the tool is equitable, and it speaks to almost all of the professionals in the family planning community in Nigeria, from government staff to private staff, even to the business professionals. Like the Shop Plus program that speaks to the private sector. So pharmacies on our patent and proprietary medicine vendors can be able to even access this innovation to see, how many people can be able to afford these family planning commodities in this particular area? Do they have the cash, or are they credit customers? So we're looking just beyond government staff. We're looking at the business community in the family planning, business sub-community in the family planning community here in Nigeria, youth leaders, non-profit, all professionals. So this tool is targeted at a large array of family planning professionals here in Nigeria, regardless of what sector they come under, private, public, or the third sector, which is the non-profit space.
Let's hear it for our semi-finalist. Will they be our next knowledge management champion? Keep watching.
For those of us from Nigeria, I'm sure that soundtrack brought back memories from the 90s, when we sat down on a Sunday evening with siblings, friends, or parents to watch a 30-minute program called Tales by Moonlight. Tales by Moonlight showcased the traditional way of passing knowledge through storytelling. Today, we call this kind of knowledge transfer edutainment, which is education entertainment. Hello, my name is Onyinye Edeh. I'm the founder and executive director of Strong Enough Girls Empowerment Initiative, also known as SEGAI, a registered women-led and youth-focused nonprofit organization committed to igniting, nurturing, and harnessing the intellectual and social strengths of adolescent girls and women through education, mentorship, and life skills development. SEGAI works with the federal government and communities in Nigeria to advance comprehensive sexuality education and family planning. Now more than ever, there's a need for localized health interventions and strategies that meet SMART objectives by responding to country context and leveraging regional expertise. But where do you find this expertise? And how do you translate reproductive health knowledge into practice? To accelerate family planning progress, particularly in Africa, Indigenous reproductive health leaders must be provided with opportunities to share their knowledge and discuss best practices. Our KM Innovation is a bilingual English and French 20 episodes podcast series that leverages creative oral storytelling to document and share real-life experiences of grassroots family planning leaders in Nigeria and the Republic of Niger, while facilitating knowledge exchange and highlighting what works and what doesn't work in reproductive health programming. By hosting the podcast on the youth-friendly and easily accessible Instagram platform and on our country partner websites, we aim to facilitate meaningful and sustainable cross-regional knowledge exchange among young people living in Anglophone Africa and Francophone Africa and global experts. We want to change the narrative on how we define, understand, and use knowledge by highlighting Indigenous young leaders who are shifting norms and driving change in their communities. By doing this, we hope to address the knowledge to action gap, strengthen the use of information for family planning programs, and prevent wasting of resources. While we will not be gathering young people in front of a TV screen like Tales by Moonlight, the Indigenous podcast will bring experts and stakeholders together, regardless of where they live, to learn and share about family planning and reproductive health. To implement this project, SEGAI will partner with the Network of Young Ambassadors for Reproductive Health and Family Planning in Niger. We are asking for $47,518. Will you support us to advance reproductive health equity? Thank you.
And now, let's go to a question and answer session.
Thank you. I'm Emily Mangoni from the Bill and Melinda Gates Foundation, and I want to say I love the incorporation of music. What a great presentation. So actually my question is, I love the idea of working with Indigenous leaders. I was surprised to see that the languages that you're planning on publishing in are French and English, so not Indigenous languages. So I was hoping you could talk to that about the possibility of making sure that it's accessible for people who don't speak English and French. Thank you.
Awesome. Yes, so Indigenous, when we say Indigenous, we really mean localized language. So I understand there's so many different Indigenous languages, but we want to start with English and French also because these are the primary languages spoken across Africa. Of course, we know that there are other local languages, and we're hoping that as we pilot this project, we're also sure that we will probably record some of the episodes in the local languages that might have to be translated to English and French, but we're using this as just a pilot. But definitely our hope is to be able to have young people speak in the language that is comfortable for them, and so that their peers as well can learn family planning information.
Thank you, Onyinye. My name is Gertrude Odezugo. I work for USAID Nigeria. I think, first of all, I think I'm trying to figure out whether this is really local for the individual countries versus, because you also talked about cross-regional exchange of ideas. So I guess my confusion is I'm trying to tie, translating reproductive health language into practice. And for me, practice, it will be more impactful in the country where we're implementing, versus, so which one is it, and especially thanks for that good music, because you started out by saying, how we, in the past, there was a traditional way of passing knowledge, through storytelling. So I guess my confusion is it locally for local consumption, or is it more for cross-regional exchange of ideas?
Really great question. And really the answer is it's both. So we want to leverage storytelling to really engage young people cross country-wise and cross-regionally. So for example, looking at Nigeria and Niger, being able to have young people, of course, these young people will be trained on how to talk about the work that they do in their communities in a way that engages the audience. So we're going to adapt storytelling to be able to communicate that information, but it's going to be done in a way that someone in another country can understand and can be able to relate to it. So in essence, it's a combination of both. But we know that a lot of the people we want to reach are people in marginalized spaces. So, and what I have learned and what my team has learned is that when we're able to practicalize the way we speak FP terms, or when we're able to use the local terms that they understand, and we want to do that through a storytelling format. I don't know if you've seen Tales by Moonlight, but the way there's an auntie, so we will coach both hosts. We will have a host from Niger. We'll also have a host from Nigeria. So of course, the host will speak French, the Nigerian host will speak English. But of course, in Nigeria, we know there's also Pidgin English. So we're able to just build a story in a language that our local communities can understand. I hope that answers the question.
Thank you, Onyinye.
Hi, Onyinye. This is Eric Bernardo from the Philippine Society of SRH Nurses. My question is, who will be sharing the real-life experiences? Are these users already with the aim of maybe encouraging those who may have unmet need, or are we just talking about family planning leaders sharing lessons learned, what worked and what did?
Yes, thank you. So we're targeting leaders. These are young people in communities, whether it's in school, at the church, at the mosque, or in the community level, who have been able to advance knowledge around family planning and reproductive health, and also use of family planning and reproductive health services. So we want to highlight their day-to-day experiences, talking to their peers and being able to promote and advance family planning through the interactions that they have, even not just with the young peers, but with their parents, their caregivers, and community leaders. So those are the people we want to target, people who are doing the day-to-day work that we don't get to see on a national or global level.
Wow, what an amazing pitch. Will it be enough to convince our judges? Keep watching as we are joined by our next semi-finalist.
Hello everyone, this is Machumu Miyeye, the National Reproductive Health Commodity Security Coordinator from the Ministry of Health, Tanzania, and I'm pitching on behalf of my colleague from Ministry and in Gender Health. As you all know that there is no family planning program without family planning commodities. So in order to ensure the availability of commodities at the last mile or at the service delivery points, the service provider needed to ensure proper ordering and reporting. In order to do that, the ministry, in collaboration with the other implementing partners, has established the system to improve the availability of commodities. This system are the Electronic Logistic Management Information System, in short we call it ELMIS, and the District Health Information System, which is a DHIS2. The ELMIS is used for capturing the logistic or consumption data, and the DHIS2 is used for service utilization data. So with this pitch competition, the ministry will work with the database developer at the University of Dar es Salaam to electronically export family planning service data from the DHIS2 to ELMIS database based on the number of commodities per method per facility. In exporting, it eases the work of service providers in using the multiple sources to make decisions in commodity ordering and reporting. So the integration of the DHIS2 and the ELMIS database will address the current inequities among the health managers whose ability to triangulate data between database varies. The majority of funds will be directed toward database improvement following service providers training, at least to 2 regions which report the high stockout, and then the ministry will continue advocating resources with the other IP to continue addressing the other remaining region. Please consider funding this innovation as we not only benefit the FP service provider, but also will be potential to scale up other reproductive and child health services and improve other essential health commodities. Thank you.
Time for the Q&A. Judges?
So I understand that you want to create a bridge from HMIS, which is hosted on DHIS2, to the ELMIS, so that the service delivery data can inform the logistics, the products. I'm curious, you had talked briefly about capacity building for, I think, healthcare providers. I'm curious, who is the intended audience for this innovation? So once this data is integrated, who will use it and how will it be used as specifically as possible? Thank you.
Okay, thank you. The intended user will be the health managers from the Ministry of Health, also from regional level, district or council level, and the health service providers. Those will be the intended users for the innovation. Thank you.
Merci beaucoup. Je réponds au nom de Daoud Idrissou. Je travaille pour l'unité de coordination du partenariat de Ouagadougou. Alors, ma question, c'est pour comprendre. Je sais que dans le DHS2, il y a un module qui permet de collecter les informations logistiques sur les quantités de produits distribués et tout cela. Pourquoi ne pas mettre l'accent sur le DHS2 pour pouvoir collecter à la fois les données logistiques et les données de prestation de services afin de faciliter la triangulation? Merci.
Thank you so much for your good question, Idris. In the DHS2, as you know, that the DHS2 is designed for capturing the service utilization data only. So when the client get the service from the health facility, then the HMIS books capture the client that client X given, let's say, injectable, and another client may be getting pills. It's just the number of clients and not commodities. That is a DHIS2 system. That's why we need to triangulate those database, the DHS and the ELMIS, so that they will lead all together and will be very helpful in the process of the quantification, in estimating what is needed in the future.
Spectacular points. But were our judges impressed? We'll know very soon. Let's see what our next semi-finalist is bringing to the table.
% of Madagascar's population lives in rural areas without access to electricity, radios, Facebook, or newspapers. My name is Maia, and I'm the executive director and founder of Projet, Jeune. My youth-led organization works in these hard-to-reach and under-resourced settings, delivering comprehensive sexuality education in public middle schools. The success of our approach depends on building and maintaining trust with communities and putting their knowledge and feedback first. We believe that to be effective, our program, and for that matter, any program, should respond in real time to community feedback about what's working and what's not. Our proposed project would develop a virtual data hub and print and digital magazine series to close the gap between knowledge and experience held at the local level and decisions made at the higher level about adolescent sexual and reproductive health and education. For the past 3 years, we've been producing a magazine series called Echo to reach tens of thousands of adolescents, parents, teachers, and school administrators in hard-to-reach rural communities in Madagascar. Students in our partner schools check out these magazines to bring home, read, and share with their parents, and each magazine has a special place for feedback. We received over 4,600 handwritten comments, questions, and suggestions from our readers in these rural communities this past school year alone. These comments hold so much untapped potential. With funds from the Pinch competition, we can bring this local knowledge to national decision makers in Madagascar. These are exactly the kinds of relevant, on-the-ground insights that decision makers have told us they're looking for, but they don't know how to access. International reports, technical briefs simply don't respond to these kinds of knowledge gaps. We will first build a virtual platform to collect, code, and digest comments collected through these ECHO magazines. Up till now, we've only done basic analysis of this data for internal purposes. We can then bring this rich knowledge from the virtual platform to national-level decision makers by means of print and digital magazines. This new series of magazines, we'll do 3 issues to start, will be in both French and Malagasy. The magazines will be themed around hot topics in comprehensive sexuality education and adolescent sexual reproductive health in Madagascar. We will also adapt upcoming issues of our community-facing ECHO magazines to gather more targeted insights on these hot topics. And that way we can create a critical loop between local knowledge and national decision-making. Your investment in this project could be transformative in changing which voices get heard in national decision-making around sexual reproductive health programs and policies in Madagascar. Thank you.
Nice work. Judges, do you have any questions for this semi-finalist?
Thank you for a great presentation. So it sounds like a really interesting idea. I wanted to know if you could speak a little bit more about what kinds of comments that you received among those 4,600 and how that will inform national level decision makers. I'm just curious, what is that gap that you're addressing? And then a second question is, you're proposing a couple different types of mediums for national level decision makers. Do you think they'll prefer digital versus paper? Thank you.
Thank you so much. It's a pleasure to be with you all today. In terms of your first question on the types of comments, most of the comments that we've received so far in the local-oriented ECHO magazine, so this is what we've been doing for the past 3 years, those comments, many of them have been messages of thanks, messages of impact on how our comprehensive sexuality education program in schools has impacted the lives of the communities and the adolescent middle school students. And so that's why the comments that we've received so far have mostly been used for our own programming and advocacy purposes, as well as creating a feedback loop back with the beneficiaries to respond to any comments or questions that they may have about our actual program. However, there's also a subset of comments that are more broadly around their needs in terms of sexual and reproductive health and adolescent programming. And those are the types of comments that we want to look at more closely, which honestly we haven't focused on to this date because it hasn't been as relevant to our mission. And looking at those comments and seeing what are the kind of impact points that the community sees in terms of what works in adolescent sexual and reproductive health programming, and then also trying to steer those conversations onto these hot topics that are coming up at the national level in terms of comprehensive sexuality education delivery, youth programming, and trying to get those comments also more targeted from the community level. So some of that's going to require us curating a new set of locally led magazines so that the comments are not just about Projet, Jeune and our work, but also about what these hot topics are that are coming out in sex education. In terms of the second question on the medium, the digital magazine and the print magazines that will be distributed to the national stakeholders will be the same content. They will be in both French and Malagasy. That gives, therefore, the stakeholders the choice of accessing whichever they prefer. We definitely have a preference for the print versions just because the magazines that we create are creative, they're user-friendly, they're accessible. And we definitely want to make a distinction from things like policy briefs or just standard Word documents by bringing in photos and virtual, visuals that otherwise wouldn't be inserted in a typical knowledge brief. So we hope that the print issues of the magazines will be the most frequently used.
Thank you, Maia. Very good presentation, actually. I think it sounds, the program sounds interesting if it kicks off. My name is Gertrude Edeh. I work for USAID Nigeria. One question that I have is really, I understand linking what we already have and putting it into forms that will be used for decision making and linking them up with the people that make the actual decisions. So how would you track that this is, how would you measure that this is what you're doing is having the impact that you intended to have?
Yes, definitely. So in the short term, at least through this project through September 2022, we would be focusing on collecting testimonies from the decision makers on how they used the information that was provided, the knowledge that was provided in the magazines that we prepared for them. And so we would want to understand how this information resonates and how they plan to use it, if not right away, at least in future decisions that they could be making in both legal but also programmatic decisions. So we recognize that with the short time, we might have to rely on that kind of qualitative evidence of use of the actual print magazines. And then at the same time, we will also continue to analyze the number and the type of comments that we're receiving at the local level and trying to understand also what the nature of those comments are, and hopefully those comments are also shifting to respond more to the content that we're going to be proposing in the local magazine. So instead of just looking at, all right, how many messages of thanks did we receive to Projet, Jeune, Leader, now we're going to be looking at a much broader set of targets. And hopefully that also is data that we can easily transmit back to the decision makers as well, to prove that this information that we're giving them is coming indeed from the local stakeholders at the community level.
Thank you, Maia.
I'm Tara Sullivan with the Johns Hopkins Center for Communication Programs, and I really appreciate your innovation in trying to close that feedback loop between decision makers and people who are working and have that local knowledge. My question is just thinking about the ways in which you're going to be sharing that knowledge, the virtual platform and the magazine. Can you talk a little bit about how you see decision makers accessing those two forms? Do you have a sense that there's demand for that they will go to the magazine or they'll go to the virtual platform? So that's one question. And then related to that, have you thought about possibly creating some kind of in-person dialogue where you would bring together decision makers and those working at the local level so that they could even further unpack and discuss some of these hot topics? Thank you.
Yes, perfect. In terms of your first question, so we have a dedicated communications and advocacy team. And so they're constantly curating relationships with what we call Big Aid as a local NGO, and also with the ministry. So that's Ministry of Education for us and Ministry of Youth and Sports. So we will build on those existing contacts that we already have. And we have our own kind of stakeholder analysis to look at among those partners, who are kind of allies, who are still a little bit unsure, not necessarily aligned with the values that we share in terms of comprehensive sexuality education delivery and adolescent programming. And so we want to make sure that we're getting a really wide audience that's accessing those magazines. And so we're hoping that the magazines can be distributed first to those allies, and then also have them then introduce the tool, introduce the resource, to their broader contacts as that intermediate. So we definitely want to build on that. We also, so I think that in terms of the virtual platform above all else is going to be an internal tool. This is going to allow us to code and to store and to analyze and to really deepen our understanding with the comments that we're receiving from the print magazines at the local level. So while we can envision that hub also being used for, say, data visualization, which is not something that we've done before with those comments. That will be kind of that intermediate step, but it'll all go into those print magazines or the online version of the print magazines, which obviously will be more interactive. People can click around, kind of grapple with additional materials if that's what they're interested in. We definitely want to use all of these resources also for in-person meetings. I mean, some of that has been delayed due to COVID, COVID. But as an organization, we bring together our local and national stakeholders regularly, regardless, to analyze and to grapple with our programmatic data. So we're just going to build on those existing activities. And one thing that we're thinking of is doing like a data party where we present, as you said, all of this information and allow them to also analyze and co-analyze with our program team to try to understand any nuances that perhaps we didn't even identify, and that they then could help curate future editions of the magazines themselves.
Great, thank you.
Soon, we will find out who our next knowledge management champion innovators are. Who will it be, you ask? Only one pitch remains.
Greetings, judges and panelists. I am Brian Kenor, a Monitoring, Evaluation, Accountability and Learning Officer from Save the Children, Kenya. Our mission is to inspire breakthroughs in the way the world treats children and to achieve immediate and long-lasting change in their lives. Did you know that 1 in every 5 teenage girls between the age of 15 to 19 has begun childbearing in Kenya? The maternal mortality ratio also stands at 362 maternal deaths per 100,000 live births, compared to our global SDG target of 70 maternal deaths per 100,000 live births. This means that twice as much effort are required to enable the country meet this sustainable development goal target. Family planning professionals experience difficulties in accessing family planning data from the Kenya Health Information System database, both at the local and national level, due to lack of login details and lack of simplified data. Without access to simplified and visually presented data and insights, it is difficult for healthcare workers, partners, and policymakers to analyze and determine trends that are useful for programming, policy, and decision-making. Unfortunately, this means that the interventions we're implementing today may not be reflecting their needs. And so, our progress in reducing teenage pregnancies, avoiding unsafe abortions, and averting maternal deaths is stalled. I'm privileged to introduce you the centralized family planning data dashboard that will draw family planning indicators data from the Kenya Health Information System database and will be anchored in the Department of Family Health website. The dashboard addresses the challenges mentioned above by creating a real-time interactive dashboard that visually tracks, analyzes, displays graphs and charts of key indicators which are disaggregated by selected parameters. With access to this data and new insights into the current trends, family planning professionals can adapt the interventions and design and implement new ones to respond to needs of young girls and women across the country. Dear judges, in order to implement this innovation, we're requesting 50,000 USD to develop the dashboard, including conducting co-creation workshops, trainings, and meetings at the national level, as well as purchase the required software licenses. We will achieve sustainability of the innovation by anchoring the application on the Department of Family Health website to be run and managed by the department's ICT personnel. We'll also adapt the health system strengthening approach by capacity building healthcare professionals to utilize this resource and leveraging and building on the close working relationship we have with the Directorate of Division of Family Planning, Health Technical Working Groups, the National Health Management Information System Leadership for continued use and ownership. Dear judges, our new dashboard will contain visuals of the Kenya core family planning health indicators that are simplified and easy to understand. We pledge with you to fund our innovation, which will inform and inspire those in a position to make a difference. Looking forward to working together with the healthcare professionals to make sure families in Kenya have zero unmet need for family planning. Thank you.
A round of applause for our 5th semi-finalist. Time for a final Q&A segment. Okay, judges, over to you.
Thank you. I'm Tara Sullivan with the Johns Hopkins Center for Communication and Programs. My question is related to use of this dashboard. Do you foresee a need to develop capacity so that those audiences you intend for the dashboard will be able to extract the data and use it? And if so, can you talk a little bit about what your plans for that might be? And then secondly, can you talk a little bit more about your measures of impact? You started to touch on that, but I'd really like to hear how you feel like the data in the dashboard will be used and how that will translate into improvements in family planning programs. Thank you.
To answer the 2 questions, one is around the capacity to use this dashboard. We use a health system strengthening approach, whereby we'll build the capacity of healthcare professionals to utilize this resource by leveraging our close working relationship with the county and sub-county health management teams. We notice that in Kenya, a lot of health facilities are devolved to the county and sub-county levels, and therefore makes management of this management and training be easier through these government structures that do exist. So using our close relationship, we'll use the health system strengthening approach, whereby we will capacity build them during the continuous medical education that we partake and we take part in during the quarterly review meetings, where we do present this data together with the HRIO and identify gaps during the deep dives and identify areas of improvement. And we intend to leverage on these platforms to ensure that the regions that we're operating in, we're able to capacity build them before we move to the next region. Secondly, towards the measures of impact, one, in the long term, we'll want to see the number of papers that people have developed and our partners and professionals in this particular development sector that have developed that cite this particular dashboard as their source of data. And we'll be encouraging more professionals to do more papers and even do collaborations with us in our programs and projects to submit more pitches and proposals to get more funding in order to move this development sector forward.
Okay, thank you very much for that presentation. My name is Gertrude Odezubo. I work for USAID Nigeria. So I'm trying to understand where the context-specific data will come from, especially as the dashboard will draw data from the KHIS database, you know. And secondly, how accessible is a website that is run by the Family Health Department, you know, to the wide array of family planning professionals that you have in Kenya?
Thank you very much, Judge Gertrude, and greetings everyone. So to answer your two questions, one is around the accessibility of this dashboard, given that it will be anchored in the Department of Family Health. We intend to work closely with the HRIOs, those are the Health Records Information Officers, and together with the county and sub-county health management teams to keep mobilizing and creating awareness of this dashboard during their various activities that include the continuous medical educations, the quarterly data reviews, and even the supportive supervisions that we do. We do reference to this data per facility, and therefore we expect that they will be creating awareness and making references to this dashboard as the source of that data that they're presenting on family planning indicators. Secondly, around the health facility, around where the data source, the data of this data source, this data will be collected. It's collected frequently on a monthly basis from the health facilities through by the health records information officers, which are then submitted to the health record information officers at the sub-county level. These health record information officers at the sub-county level then feed this data into KHIS, and therefore this means that the data that is being collected has been collected from the facility level. And therefore this reinforces the importance of this dashboard, as we will be doing reference checks with the health facilities, ensuring that all their data has been captured to this dashboard. I hope that addresses those two questions. Thank you.
Thank you.
Merci beaucoup. Je réponds au nom de Daoud Idrisso. Je travaille pour l'unité de coordination du partenariat de Ouagadougou. Ma question, c'est par rapport à la qualité des données qui vont venir nourrir le tableau de bord. Comment faites-vous pour garantir que les données fournies par les formations sanitaires sont d'abord de bonne qualité pour pouvoir nourrir ce tableau de bord qui sera visualisé par les décideurs?
Thank you very much, Judge. I appreciate that question. The quality of this data will be ensured by first ensuring that the people who collect this data are the healthcare professionals themselves, and this data is always collected through MOH 413 form and MOH 713 form. Using these two particular forms, we're able to capture data at the facility level. This data is then submitted to the sub-county person who is responsible to oversight the data collection and even entry into the KHI system. And therefore, the data that will be read from the KHI system is data that has been approved by both the health in charge at the facility level and the HRIO officer at the sub-county level. And therefore, this ensures that this data has been captured correctly. And during the quarterly review meetings, this data is also reviewed to ensure that whatever was captured on paper, the physical registers at the family planning department at the health facility, are what is reflecting in the dashboard. And therefore also this increases visibility of that data, showing where which data is missing and where which data has not been captured correctly. Going to the issue of how the family planning professionals and partners will be using this data. One is through the creating awareness of this dashboard, then professionals and partners can be able to develop papers and proposals to seek for funding to implement family planning programming. And these include partners, development partners, not only national government partners, but also partners out here who lack the login details to KHIS. We expect that once this dashboard is published into a government website, then accessibility issue will be an issue of the past.
Thank you to all of the semi-finalists for sharing the exciting knowledge management innovations. It is clear that any of these ideas would help improve family planning and reproductive health programming. The judges now have a hard decision to make. Which knowledge management innovations should they fund? I'd like to ask our esteemed judge, Tara Sullivan, to share with us what the panel of judges has decided. Who are the final knowledge management champion innovators?
I'm pleased to announce the final KM Championship innovators, who are Strong Enough Girls Empowerment Initiative, Nigeria, for the Indie Genius, a bilingual podcast series. Their innovation is culturally relevant and multi-country. It is feasible and elevates voices of Indigenous youth leaders. We love that it is a female and locally led group, and that it presents knowledge of Indigenous young leaders who are driving change in their communities.
If Segai were to win this competition, it would mean representing and amplifying the voices of amazing young people who day to day are making change happen in their communities when it comes to advancing family planning and reproductive health. It's just going to be amazing to be able to highlight those untold stories in a fun and engaging way, but also transformational way.
The judges also selected Save the Children Kenya for the centralized family planning data dashboard. We love that this innovation will provide access to data and insights. We appreciate that they will build capacity of healthcare professionals to use this important resource, and we feel that it is feasible within the time frame and also sustainable beyond the funding period.
And this will mean that we'll make data easily available for all family planning professionals, including partners and stakeholders. Winning this particular innovation will be a great achievement for me and for the organization as well.
Yesterday, we awarded 2 knowledge management champion innovators in the Asia competition. Today, we awarded 2 organizations in Africa. And now it's my pleasure to announce which organization will be awarded the 5th award. This award goes to a winning pitch of the judge's choice and can come from either region. The winner of this 5th innovation is Projet, Jeune leader, Madagascar, for the virtual data hub and print magazine series on adolescent sexual and reproductive health. The virtual data hub and print magazine series will create a critical loop between local knowledge on sexual and reproductive health and national level decision-making processes in Madagascar. It is an innovative idea for disseminating contextualized evidence. It brings forward local voices to decision makers.
This will be a huge win for Projet Jeune Leader, and I think it's going to really raise our national visibility to be able to play this key role of connecting these 2 key stakeholders that we have.
Congratulations to our knowledge management champion innovators. Once again, we'd like to express our deepest gratitude to all of the semi-finalists for the effort that they have put forward in developing their pitches. All of the innovations shared today can be found on the Knowledge Success website at knowledgesuccess.org. We'd also like to thank our judges for their thoughtful deliberation and time today. We know that we didn't ask them to make an easy decision. Finally, our sincerest thanks to the semi-finalists, judges, and to you, our listeners, for your continued dedication to the family planning and reproductive health field. You are making a difference.